I can show it right now. Please come here. I need a piece of paper. This is also the biological feedback in the body. For example, I want to know if the cervical spine functions properly in this patient. I have doubts. Do you have doubts? I have no doubts. It doesn't work well. You have no doubts. It works badly, I see, but I want to know how exactly. I'm taking a piece of paper, this piece of paper, and the patient's hand. I want you to find a piece of paper as well and take your neighbor's free hand. Put the piece of paper between the person's fingers. Do you see? Please squeeze. Squeeze. You wanted to squeeze, right? You wanted to squeeze, no? And here it functions fine. Everything's fine. And here everything's fine too. Here everything's fine as well. Only your little finger doesn't function. So I am checking the muscular contraction effort. I want to know what can be done with another palm. Here everything's fine. Here. Well, I see. The middle finger has no grip. Here everything's fine. Here everything's fine. This patient has neurological deficit. Her little finger and her middle finger, in another hand, are not strong enough. I want to know if I can help her and if it depends on her cervical spine. I'm asking her to bend her head like this, a little. Why? I'm making her relax this muscle and I'm checking if there is nerve compression here. I'm checking if something has changed. No, no changes. And if I unbend her hand, will something change? No, nothing changes. And if I bend it again, will something change? No, it's useless. This deficiency is not related to her cervical spine. If I stretch her arm a little, like that, I relax her smaller pectoral muscle, will something change? It means that her problem is not in her cervical spine. It's not the scalene muscle, but she has some issues with her smaller pectoral muscle. Again, if the patient's nervous system is okay, it is reflected in the muscular contraction effort. Anyone can perform this test. You just take a piece of paper and you place it between your fingers and you see. Do you see the difference? Do you see and feel it? Yes, of course. Do you want to know what you can do to restore this finger's innervation? You ask your patient to bend and unbend her head to both sides. If you detect something, you'll see the change of the muscle contraction effort. You've got an issue in the cervical spine. But if nothing changes in the neck motion, you should do nothing with the cervical spine. You have to search for the other issues. Let's go lower. The first level is the smaller pectoral muscle. It stretches. It stretches from the third and the fifth pair of ribs, and it is attached to the process of scapula. Just under it, we've got the nerve tract, and when it contracts, it squeezes this tract. I'm just taking the patient's arm and moving it closer to here to relax the muscle. After I do that, the muscular tone is back to normal. This is how you can use the quantitative change of effort to measure the degree of the nervous system disorder. In the other hand, the little finger was engaged wonderfully. You can try it too. Here something is wrong. I'm checking if it is related to the neck. I'm bending the patient's head, relaxing the scalene muscle, and checking again. No, you can bend your neck again. Well, once again, please. Your chin, please. You need here to bend the head. Something is wrong in the cervical spine when the patient unbends her head, which compresses the nerve. For a long time, we tried to find and use the contraction effort as a method of the biological feedback because there are lots of methods to check the nervous system, and one of them is to check the contraction effort. Besides, the degree of the pain syndrome matters, and I've shown it many times in my previous webinars how we work with the pain syndrome, and we look for the cause of this pain. Do you remember how we worked with the pain syndrome, how we were looking for that? For the cause of the syndrome. If we detected the pain syndrome in the thoracic spine, I want to know what changes if the patient sits down. It's less. Really? Yes. We explained it a lot, and if you want to know how we can use the changes of the pain syndrome to assess the biological feedback, you can watch the webinar on the visual diagnostic of the problematic statics and dynamics. Please switch on the presentation once again. Frequently, we use the patient's position and his muscular irritability. For example, when the patient's muscle is engaged in the wrong way. Look, the patient is raising his leg. Here you can see it. Here you can see it very well that the patient is raising his leg, but he's raising his leg not with his gluteus maximus, but together with his pelvis, with his psoas muscle. This distorted irritability of his muscle makes us think that his gluteus maximus is not irritable. If the patient here, in this patient here, you see that his posture is wrong. You can see that his sacrospinalis is too short. If one muscle is too short, the opposite one should be extended. There are the visual diagnostic methods. There are lots of methods to assess the nervous system function, which can show that some muscular functions are wrong.